We're on to lab activity 27, the respiratory system, starting with the anatomy. And we have the list starting with the external nares. So moving right over to the models. We'll begin with the external nares. That's the term for the opening of the nostrils. External nares. External always meaning at the surface. And we have the space, the large space of the nasal cavity. Within, we're able to see the three particular branches here, known as the turbinate, or superior, middle, and inferior nasal conchae. The nasal septum, this is bony ridge, of course, here, separating the two halves. And here we could see the inferior and the middle nasal concha. Moving along, we have now beyond the nasal cavity, just the narrowed area right here. This is the area of the internal nares. And just beyond the internal nares, we have the area of the pharynx. So it starts here. We're highlighting the border, the space of the nasopharynx. And within the nasopharynx, we're able to see the opening into the auditory tube that leads, of course, up to the middle ear. Still in this region now, at the tip of the nasopharynx, the boundary, the soft tissue right here is the uvula. And that's the border for the nasopharynx. We can see the location of the hyoid bone, and we'll see a better model for that, hyoid bone. And inferior to that area, we move into the region of the larynx. Again, we'll see closer detail. So we'll switch over to this model of the larynx, and we're able to see the hyoid bone. And we'll see a couple different views for the hyoid bone. We have the larynx as a whole, and in particular, this piece is the epiglottis. We have the thyroid cartilage viewed here from the anterior side, and inferior to that, the cricoid cartilage. And then here, moving down to the area of the trachea. And a couple of different views for this model. Posterior view, so much better view of the epiglottis. Still the hyoid bone we're able to view. The thyroid cartilage from the posterior side, as well as the cricoid cartilage from the posterior side. And down here, another view, posterior side of the trachea. So now specifically with this posterior view, we have the cricoid cartilage, and now superior to the cricoid cartilage, we're able to see the area of arytenoid cartilage. And then superior to the arytenoid cartilage, just the little cone at the top there, this is known as the corniculate cartilage. So these are some viewed from the posterior side, arytenoid and corniculate cartilage. On the trachea itself, we can see the C-shaped tracheal rings. Notice this incomplete here on the posterior side. And just going back to that. So the detail of the tracheal cartilages, each of these segments here. And on the posterior side, where the tracheal cartilage is incomplete, this would be the location of the trachealis muscle. And that incomplete posterior segment. And just the lateral view, a lot of the same things. Hyoid bone, epiglottis, thyroid cartilage, the cricoid cartilage, trachea with its distinct tracheal rings. And still another view looking down into it, Here's where we're able to see the space, the opening, and that space is called the glottis. So now moving along from the area of the larynx, we can see down the trachea, and at this point moving on to the lungs. So of course we have as a whole the two lungs located in there's the left and right pleural cavities. The membrane lining the cavity, that's the parietal pleura. The membrane, of course, touching right on the surface of the lung would be the visceral pleura. And with the heart removed, we're able to see all of this central space here of the mediastinum, all of that area medial to the two pleural cavities. The diaphragm muscle once more. So the lungs and the heart rest right superior to the diaphragm muscle. So moving into the details that we're able to see now in these views. Moving down the trachea, and we see as it branches, the first branches. These are known as primary bronchi. And then we can see them branch again. So these are now the secondary bronchi. And now when secondary bronchi have further branches, these are now the tertiary bronchi, just each branch point, just first, second, and third, primary, secondary, tertiary bronchi, branching throughout the lungs. And taking a look at the lungs themselves now, we have to the left lung, there's a superior lobe and an inferior lobe. Whereas now for the right lung, there's three lobes. There's a superior lobe, there is a middle lobe, and don't see it well on this image, there's an inferior lobe. So three lobes to the right lung, and separating them, only to the right lung is there a horizontal fissure. There's this separation here. And we can see just a bit of an oblique fissure as well. And the left lung with only two lobes, there's only one fissure called an oblique fissure. So now moving along to activity 28, it's the histology for the respiratory system. And we're viewing the trachea. What we're able to see here, starting from the internal space of the trachea, the first layer is where we have the epithelial tissue, and it's pseudo-stratified, ciliated, columnar epithelium. We could move deeper in, penetrating into the tissue, and it's at this area is where we're able to see that tracheal cartilage. And we'll move to another view, just close in, so now you can just really see the tissue type, PSCCE. And we can see the cilia, of course, extending into the... So from the posterior view of the trachea, we're able to see this trachealis muscle, and we can label it here, trachealis muscle. But we notice how the epithelial tissue is a full ring all the way around. So pseudo-stratified, ciliated, columnar epithelium. We have to span across this layer to reach the tracheal cartilage. And on the posterior side, we can see how the tracheal cartilage just tapers off and ends. And it's on that posterior side where the tracheal cartilage ring ends. That's where the trachealis muscle begins to pick up. So continuing now with the histology of the lung, what we first want to find is now the alveolus. The alveolus and they're lined with the simple squamous epithelium. So the alveoli, they appear as these spaces here. Let's put the letter A. So you can see there's a larger open space, and then there's kind of these little areas here, partially enclosed. So we can see multiple alveoli all around. The lung is composed of a few 100 million alveoli. And the tissue that's bordering it, right on the edge, there's our simple squamous epithelium that borders and forms the structure of the alveoli. So you can see that thin, delicate layer of the simple squamous epithelium. We'll have to move around the sample here. Now we're seeing this large tube, and this is a view of a bronchus. And a principal trait to recognize with the bronchus is that we're able to see, in this case, this blue staining to the hyaline cartilage. So here's a good segment. And in terms of the details, from the very inside surface, and let's point to that correctly, there we go. Thus, we'll once again have the pseudostratified, ciliated, columnar epithelial tissue. And we'll zoom in for a closer view on that. The smooth muscle tissue, you see the staining right here in pink for smooth muscle. And we've already pointed out the hyaline cartilage. Whereas compared to a bronchiole, bronchioles do not have this cartilage, and we'll see that in a moment. We'll zoom in. Here we are looking at the bronchus still, so we can see the pseudostratified, ciliated, columnar epithelium. We can see the smooth muscle tissue, as well as here's a closer look at some of that hyaline cartilage. And even closer on. So the PSCCE, some of the smooth muscle, and here's a really close look right into the hyaline cartilage for the bronchus. Whereas we skip to a bronchiole, we see the tube here, and it's lacking any hyaline cartilage. So that's the reference that it must be a bronchiole lacking cartilage. So now we're moving into activity 29. And this is histology for the blood vessel. So that's starting here. So just to begin, at low power, we can see an artery versus a vein. So arteries keep more of a rounded shape when there's no pressure. Veins tend to flatten out and fold. Arteries have a thicker layer to them, a thicker tunic, where it's much thinner in veins. And going into the details for the lab, we want to point out a few items. So we'll point out tunica intima, tunica media, smooth muscle, and adventitia. So we'll point out those items. So let's begin here. So starting from the inside of the blood vessel, we have the innermost layer, just that thin pink line, and that is the tunica intima. The middle layer, that is the tunica media, and the external layer, that's where we have the tunica. It could be called externa or adventitia. Either name is correct. And we'll zoom in for the details. So closer in on the tunica intima, so we're seeing that very thin layer. A much thicker layer, especially in arteries for the tunica media. And at this point, we can see the smooth muscle tissue. And now the external layer, connective tissue. Again, tunica externa or tunica adventitia. And switching over to a vein, again, a vein has overall thinner tunic layers, especially a much thinner tunica media. So just the inside layer, tunica intima, the middle layer, tunica media, much thinner in veins. And on a vein, the tunica externa is actually the thickest tunic on a vein.